everyone, Kaitlin here. Welcome back to another episode of Baldwin Breakdowns, where we're looking at big concepts, big ideas, and lots of big feelings in 10 minutes or less. And you might be looking at the timestamp of this video and realizing that it's more than 10 minutes because this particular topic I wanted to give a more in-depth review of kind of all the tenets of this model of therapy, which is acceptance and commitment therapy. And so for me, this is kind of the backbone of all of my work with clients. Sometimes it's a model that I stick to really religiously. Other times it's just a very flexible part of how I approach mental health and therapy. And so watching this, you might be a person that's interested in learning more about therapy, and in particular types of therapy aside from CBT or DBT. You may be a client that has connected with me, and I may have sent you here to look at this video and kind of understand a bit more about the way I work or the way I conceptualize things. But so I am just excited, and I realize that I say I'm excited at every single video that I put out there, but I am really excited to talk about ACT because it is, like I said, kind of the cornerstone of my work as a therapist. So let's get into it. Okay, so ACT, as I'll keep calling it because acceptance and commitment therapy is very long, ACT is a model of therapy, obviously, and it looks at the processes that underlie psychological flexibility. This is a very common term within this model that I'll explain a bit more in the next couple slides. But basically, this model, instead of having a specific set of protocols for different symptoms, so like this is how we treat anxiety, this is how we treat depression, ACT has these main processes that we look at, which underwire kind of all of our mental health and all of the way that we approach life in general. And so within this model, there are two main areas of focus, one of them being mindfulness and the second one being behavior change. And then within that, there's kind of three main pillars. So one of them being openness, about our ability to open up to things. The second one being awareness, so how aware and connected are we to what's going on inside and outside of us. And then third is engagement. And this really looks at if we're connecting with and doing and physically acting on the things that are important to us. So I just wanted to give that kind of summary quickly before we go into the specific nitty-gritty of all these different processes. I wanted to include this slide briefly just to really be clear about the fact that ACT is an evidence-based treatment. And I say this because I often get referrals from doctors or parents that are looking for specific types of therapy like CBT or DBT, which are very commonly known, commonly researched, or there's a lot of evidence because they've been around forever and ever and ever. But ACT is evidence-based, and there are over 1,000 research articles that prove its efficacy at the same level of those exact same therapies. And in my personal opinion, I think it does a much better job at supporting people, especially people that get kind of really stuck in those more traditional forms of therapy like CBT. But because it's a process-based model, what's great about it is that it has the flexibility to really treat any type of symptom or problem or whatever you want to call it. And so just to name a few, there's anxiety, depression, PTSD or trauma, chronic pain, job performance and job stress, psychosis, life satisfaction, and so many more. So there is a lot of research supporting the efficacy of this model as a form of psychotherapy. I'm not going to go into a ton of detail about this slide, but I wanted to put it out there before going into the idea of psychological flexibility, because on the opposite side of psychological flexibility is psychological rigidity, which is shown here. And so again, I'm not going to describe each of these specific processes because I'm going to go into the flexibility ones in a few moments. But I wanted to just have it out there to demonstrate that a lot of what underwrites our struggles with mental health and our suffering fall within this realm of psychological rigidity. And so that's when we may have really rigid rules or restrictions about who we are, who we should be, how we should act. And so this is just kind of the flip side of flexibility, which is what we aim to achieve and we aim to improve through the use of ACT. Okay, so remember at the beginning I said that there were two main areas of focus, mindfulness and behavior change. What I've done here in this hexagon of the psychological flexibility processes, a hexagon because there's 6 processes, is I've shown the breakdown of which processes fall under the realm of mindfulness, shown there by the brain, and then which ones fall within that realm of behavior change. And so I'm going to go through each individual process, but I just wanted to kind of show the overall breakdown, and that's why the text is so small on some of the processes, but I wanted to include all the information on a single slide so that you can kind of have a snapshot view of the entire processes and those 2 areas of focus overall. The first process within that umbrella of mindfulness is acceptance. And so I actually have another video on acceptance that I did many months ago that I might link somewhere here if that ever shows up. But so the process of acceptance is about the act of opening up and making room for the unwanted inner experiences. So if you think about emotions of like happiness or excitement or joy, typically most of us feel pretty open to those things. And then when it comes to the more distressing emotions or thoughts or sensations, there's kind of this instinct to close up or to avoid them. And so acceptance is about really opening up, allowing those things to be there, making space for them to be there. And so some of the ways that we may tackle this in a therapy session or in someone's homework to work on their own is through this use of mindfulness. We may engage in just noticing practices, so really trying to tune into what's coming up without trying to change it. We may use breath work to kind of breathe in and practice that expansion, like opening up space. And it's also a form of exposure work, which is really common in CBT, but you're essentially exposing yourself to this difficult, unwanted feeling so that you can feel more comfortable with it in the future when it comes up. So diffusion is another one under that mindfulness umbrella, and I think I have a separate video about that one as well that I might link. But the process of diffusion is, and not diffusion like D-I-F-F, it's diffusion, meaning to defuse yourself, is about learning to step back from any cognitive experiences. This may be thoughts, memories, or images. But this act of defusing is to lessen the hold and the grip that those cognitive elements have on you. And so the techniques or strategies that we might use could include visualization, so kind of physically imagining those things being outside of you or in front of you. Specific language skills, there are kind of ways that we can speak about our thoughts or memories that give us that distance, and then also the use of metaphors, so kind of helping us imagine that, okay, these things are separate from me, these thoughts aren't me. Self as context is one of the processes that can be maybe the hardest to conceptualize, but the idea is that rather than being really caught up in the content of what happens, the understanding is that there is a self, and that self is the observer of all the stuff that happens. So the self isn't the same as the thoughts and the feelings and sensations. The self is the observer of thoughts, feelings, sensations, memories, anything that comes up. And so a great example of this is to imagine that yourself, you are the sky, and all of your thoughts and feelings and emotions are the weather. So some of the techniques that we might use for this in therapy would be, again, under that umbrella of mindfulness. We'll engage in a lot of observing and noticing to try and kind of separate those things, perspective taking, and also metaphors. Again, metaphors are really, really big in ACT because they help people kind of connect these very conceptual ideas to something real, visual, and tangible. Okay, so now we're into the realm of the behavior change processes. And the first one I'll talk about is having clarity on your values. And so this one is relatively straightforward. This process is really just making sure that you have an understanding of what things and what people matter to you. So when we have a lot of lack of clarity about what things we care about and what our values are, then it can be really hard to understand where we want to go and how we want to act. And so gaining clarity over this and that process can be really helpful to guide us as we move forward, both in how we want to act kind of externally in the physical world, but also how we want to act towards ourselves internally. And so the ways that we may kind of go about this particular process in therapy is we may do some more formal like values assessments, or we might just have really explorative conversations to kind of unpack your history and understand a bit more about what things matter to you specifically. Committed action is a process that follows on the last one in terms of gaining clarity over your values, because committed action means that you are consistently and in a committed way doing things that act in accordance with your values. This includes both of our physical actions, so the things that we do kind of out in the physical world with our physical body, but it also involves our psychological actions. And so physical actions could be, if I really value health, my physical actions could be exercising, eating well, things like that. My psychological actions could be how I speak to myself internally, how I respond to thoughts about health. And so some of the techniques or strategies that we may use in therapy would be behavior activation. So this is kind of getting us motivated and doing actual behaviors. Practicing vulnerability, and also looking at change talk, so identifying your reasons and desires for wanting to make certain changes. And the last process is the present moment and connecting with the present moment. So this is about paying attention to the here and now, engaging not only with what's going on outside of us and kind of our external environment, but also what's happening inside of us. And so the techniques that we might use within this one still engage in mindfulness. We may connect with some grounding activities, some observing and noticing again, so really tuning into your senses and what's happening internally and externally. And we may also use some breath work and movement to really connect with the here and now present moment experience. So that's acceptance and commitment therapy. That's it in a very structured, systematic way. What's really wonderful about acceptance and commitment therapy is it's so flexible with how we can approach it. So there isn't any rigidity in it. We can kind of go from talking about one thing to another, to practicing this, to practicing that. It's so wonderful and I really recommend it, and that's why I personally practice it with the majority of my clients. If not in a super explicit way, it's kind of always underwriting the way that I approach my work. So thank you guys for watching this video, and stay tuned for the next episode of Baldwin Breakdowns. Bye.